let's play. I was like, did I do it? I did. All right, guys. Ooh. Here we go. Here we go. Here we go. Go, go. I have this on my thing. Okay, cool. Hey, y'all. Hey. How y'all? Okay, we back. How y'all doing? How y'all doing? All right, guys. So it is Thursday, NCLEX Jeopardy Thursday. You already know what it is. Just in case you don't, it's NCLEX Jeopardy Thursday. Hi, how you doing? All right. So for NCLEX Jeopardy this week, these are our categories. All right. So this is also week 3 of Camp Nursing School. Ooh, peep the shirt. Peep. Do you like it? Do you want it? Do y'all want this shirt? I got it for me, but I can put it up for you guys if you guys kind of want like camp merch or something cute like that. I'll put it up if y'all want it. But yeah, so our categories for this week, we have fundamentals, lab values, cultural, ABGs or arterial blood gases, and a wild card. That's pretty much like the random deck, okay? Like I said, it is week 3 of Camp Nursing School, and this week we are focusing on fundamentals. Okay, we're going back to the basics of care, kind of, you know. So yeah, a lot of what we're going to be going over today is kind of like throwback for those that are either already nurses and just want a little cute little refresher. If you've already like done your first semesters, so you're in your second, third, and so on and so forth, depending on how many years you're going for, this will be a good refresher for you. People like to underestimate fundamentals, but that is where literally the fundamentals are, okay? If there's anything that you need to know, any concepts you need to know, it's those that are in fundamentals, so that you can take that and apply that to med-surg, path, you know, whatever else out there, okay? So hey, all you guys. If you need help with T's, especially the entrance exam, the ATI T7, we do that on Tuesdays. T's Tuesdays. NCLEX is for Thursdays. Okay. All right. So perfect. Tag anybody that you need to tag that may need a nice review, whether they're reviewing for their NCLEX, if they're reviewing for whatever exam, if they haven't started yet, but they're about to start nursing school. This is a great review / refresher. And it's fun, and we play for points. Okay, so like I said, just in case you have not been here before, hello. Let me know if it's your first time playing NCLEX Jeopardy. Let me know down below. We play for points, okay? So every man is for himself, or every sis is for herself, however you want to say it. But yes, these are our categories. These are our questions. We have 5 questions per category. Each of them are going to range between 100 points and 500 points. What we're going to do is that when I pull up the question, you're going to be able to see it, and I'm going to also read it out loud as well. You do not have to wait for me to finish reading the question for you to answer. Okay? So when it comes up, you read the question. When you feel like you have the answer, go ahead and comment what you think your answer is. Now, this is Jeopardy style, so you have to say what is in order for the points to actually stick, okay? In order to qualify for those points. Now, if you're not here for points and you're here just for the review, it doesn't matter if you put what is or not, because in the actual NCLEX, it's not Jeopardy style. Okay, so you don't have to put what is, and you don't even have to worry about being the first person to get it correct. But because we are incentivizing this specific, well, not this specific session, but because we always incentivize it. We're incentivizing this review. We're gonna put some parameters up there. Okay, we're gonna put some house rules. We're gonna make it fun, interesting, competitive, but friendly competition. Okay, so remember, you have to say what is. Quick little tip. If you type what is in the comments, copy and paste it, it'll save you like 2 seconds. But those 2 seconds will really, really help, especially if you want to win. Now the winner, the person's the first, or the only person, the person that has the highest amount of points when we are all finished with our questions is going to be the winner for tonight's NCLEX Jeopardy game, and they are going to win a free nursing school bundle, a free ultimate nursing school bundle. All right, so that is a $97 value, 400 pages. It is a digital but printable study guide, okay? I guarantee you haven't seen study guides like this, okay? We just make it fun, we make it interesting. We tap into what you associate with pop culture, entertainment. We associate nursing topics and concepts with those things to make it entertaining and fun so that you retain more. Okay, so that's also why the reasoning behind why we do NCLEX Jeopardy as well. Okay, so let's go ahead and get started. If y'all have any questions, especially as we go along, just go ahead and drop them in the comments. Okay, so we go over the question, we go over the answer and the rationale. If y'all have any questions throughout any of that, go ahead and put them down below. Okay, so this is slick, like a review game / group study session, but this study group, I know you probably had horrible study group experiences in your past, because so did I, but this study group right here is different and super fun. All right, you about to get blocked. Don't come out here. Duh. All right, so also whomever has the right answer on Sam's screen. Oh, thank you, peer buyout. Thank you so much. Now, this is on Instagram Live, no shade Instagram, but just in case there's some connectivity issues, depending on if you're on like Wi-Fi or if you're just like using your cellular data, you may or may not experience some lagging. If you experience lagging, you can do one of the following things. Okay, you can leave the live and then come back in to kind of reset it. Well, yeah, that's the only suggestion I have, honestly. Or if you're not connected to Wi-Fi, make sure you connect to Wi-Fi. Now, as I am looking at my screen, looking for whoever answers correctly and first, okay, and saying what is, that's going to be the person that wins the points. Just in case we have two people that's like neck and neck, and maybe it comes out, person A is number 1 for me, but person A is number 2 for you, just in case somebody's name shows up out of order. I can only go by my screen. Okay, I can only go by my screen, but as long as you know you are answering these questions correctly, you are grasping the material, you are comprehending it, and that is the real prize. Okay, all right, so let's go ahead and get started, guys. I've had a great day, Haley. Thank you so much. How about you? All right, guys, let's get started. First question. Now, in honor of it being obviously week 3 of Camp Nursing School, and we're doing fundamentals this week, we're gonna start with the fundamentals question. Okay. All right, let's go ahead and get started. Let's get started with fundamentals for 200. Remember to say what is when you are answering. All right, in Maslow's hierarchy of physiologic needs, the human need of greatest priority is A, love, B, elimination, C, nutrition, or D, oxygen. All right. Just in case this is your first time, hello, welcome. I'm gonna always say like test taking tips, test taking strategies, things that work for me to see if they work for you, so you can try them as well, see if it works for you. But as far as like the tips, take these tips and run with it, okay? Whenever I read the question and I read the answer choices, I do that once. Question, answer choice, and then I go back to the question, or at least the last line of the question, to remind myself of what the question's actually asking me, what they want me to answer. Okay, so once again, in Maslow's hierarchy of physiologic needs, the human need of greatest priority is what? All right, first of all, whenever you see the word priority and greatest or most, that is a strategy word, so pay attention to that. All right, love, elimination, nutrition, or oxygen. What is our answer? Y'all remember the Maslow's hierarchy? I know y'all have y'all ultimate nursing school bundles or y'all first semester bundles. I know y'all have one of the two, or the fundamentals study guide. Go ahead and open that up. Where's mine? Wait, oh, here it is. First semester bundle. Open that up to fundamentals. Let's see what our answer's gonna be. All right, I'm getting lots of D's and C's, which is nutrition and oxygen. Let's see what our correct answer is. Drum roll, please. Somebody, drum roll. And the answer is, what is C? Wait, hold on. I just want to make sure I did not put them out of order. Oh, I'm an idiot. I put them out of order. I'm an idiot. So it's oxygen, but I put C, it's oxygen. Oopsies. Hold on one second. Okay, so for y'all that was saying C, which is nutrition, or D, oxygen. It's D, oxygen, but this says C, but we know it's D, okay? All right, so it's oxygen. Forget the letter, it's oxygen. All right, so Maslow, who defined a need as a satisfaction whose absence causes illness, considered oxygen to be the most important physiologic need. Without it, human life could literally not exist. Okay, you can't eat without oxygen. You can't function without oxygen. Airway, breathing, circulation. Remember those ABCs? That goes hand in hand with our good old Maslow's hierarchy, okay? Our physiological needs right down there. I'm not going to squint into that. But this little page right here is in your Fundamentals of Nursing study kit. If you have that individually, or if you have the first semester bundle or the Ultimate Nursing School bundle, you'll have this kit, which will include this page. All right. So as far as the Maslow's, it's right after the injection site cheat sheet. Our physiological needs: food, water, sex, sleep, excretion, and oxygen. Those are our physiological needs. And it's lots of people probably think that sex is up there, okay? Sex is probably number one. Right next to oxygen, they're taking a breath to go mess with something. So some people probably think that sex is up there, but no, it's not. But it's still a physiological need, just the order. But oxygen is definitely the most important, okay? You need oxygen to breathe, not penis. Okay? All right, first person to get that answer correct is, let me get my handy dandy pen. Oops. What is C was, that was nutrition back in that. So it'll really be whoever said what is D or what is oxygen. Amina, you said what is D? I mean, you said D, but you didn't say what is, so you don't get the points, but you got it correct, so great job. Life, W, my. Life with mine. First person to say what is D, which was oxygen. Ignore it saying C right here, because on the question it said D. C was nutrition. Okay, so life, W dot my. Congratulations, you are on the scoreboard with 200 points. Awesome job. Who else got it correct? T-Pain, Giselle Jones, Blessed Favored Beauty, Petite 1990, Nurse Deanne Marie, Bad Gal Nene, who was Tishara, You Love Now, Will Nelly, Lee Chester, Mama K to You, Only Nasia, Sweet Persuasion, great job. Not penis. Yes. All right. Great job to everybody. All right. So now let's get into our next question. That was fundamentals for 200. Let's do lab values for 200. So it's my first time that's why I done it. It's okay. We got plenty minute questions, and now you know. So yes, for anybody that's just joining in, this is NCLEX Jeopardy. It's Jeopardy style, so you have to say what is, okay? On the actual NCLEX, it's not Jeopardy style. I'm just making it fun for tonight. For an hour out y'all week, I just want to make NCLEX fun and entertaining. Cool? All right, so lab values for 200. The client with metastatic breast cancer is receiving tamoxifen. The nurse specifically monitors which laboratory value while the client is taking this medication. A, glucose level. B, calcium level. C, potassium level. Or D, prothrombin time. Remember what I said, after you read the whole thing through, go back and at least read the last line. The nurse specifically monitors which laboratory value while the client is taking tamoxifen. Okay? Glucose, calcium, potassium, or prothrombin. All right, so let's look and see what our answer is. NC Pink Rose did my answer not show? I didn't see an answer up there. So it probably did not go through. But that is okay. I saw that, so we know at least it's working. So let's go ahead and see what our answer is for lab values for 200. Lab values for 200. Drumroll, please. And it is, what is B, calcium level? What is B, calcium level? Who's first? A lot of people said D. A lot of people said D. I don't remember what D was. Prothrombin time. That's what it was. But yeah, B is calcium. And the first person to get that one correct is Shanice A. Bandy. Sure. Hey, Shanice. What's up, girl? Great job. Great job. Shanice. She. N-E-C-E. Bandy. All right. Congratulations, Shanice. You're on the scoreboard with 200 points and tied with my good sis, Life with Mine. Okay, great job. Who else got what is B or calcium? Siptastic, great job. Wait for it. Real Loves You, great job. Awesome job. All right, so a lot of people got with that, and that is perfectly fine. Like I said earlier, this is what practice is for. Okay, you're not supposed to look cute and get all the answers right during practice. It just doesn't happen. It's not practice at that point. It's a performance. So yes, practice will make progress, but in order for you to start making progress, you gotta practice. All right, and what better way to practice than with me? Y'all know y'all love me. I love you too. Okay, so just in case you got that incorrect, let's figure out why it was calcium and not prothrombin time or potassium. Usually the answer is usually potassium, which is funny, but in this case, that's not. All right, so rationale says tamoxifen, that's the medication, that's the drug. Another study tip, whenever we have questions and in the question it's mentioning a medication, do yourself a favor and just write it down in the corner somewhere so that after you finish your review, you can just go back and just look over what that medication is, just so you know. But tamoxifen is this medication. It says it may increase calcium, cholesterol, and triglyceride levels. Before the initiation of therapy, a complete blood count, or CBC, platelet count, and serum calcium levels should be assessed. These blood levels, along with cholesterol and triglyceride levels, should be monitored periodically during therapy. All right? So, if tamoxifen increases calcium, cholesterol, and triglycerides, complete blood count, or CBC, is going to get the calcium. What other type of test will get the cholesterol and triglycerides? All right? To get calcium, we need a CBC and probably a CMP, a comprehensive metabolic panel. But it's another type of panel that will get cholesterol and triglycerides. What's it called? Just in case you see this question again, but reworded. Thank you, Mrs. America. Lipid panel. okay? Just in case they don't tell you the individual ones, you may get a question that's like, which of these lab tests does the nurse expect to the doctor to order for a patient taking tamoxifen? And it'll say PT-INR test, it'll say lipids, and maybe select all the apply or something. Lipid panel, complete blood count, CMP, and because you know it's calcium, cholesterol, and triglycerides will be taken care of with the lipid panel. And the calcium will either be the basic or the comprehensive metabolic panel, or just a serum calcium. But at least you know what their the other lab tests are classified as, just in case you get it and it's remixed. Okay? All right. Great job. Next question. Remember, this is NCLEX Jeopardy. If y'all have any questions, drop them below. Either I or someone else will answer it, whether it's a content question or game question. And make sure you say what is whenever you're answering so you can qualify to receive these points to win a free Ultimate Nursing School bundle. Okay, so let's go into our next question. All right, cultural for 100. Okay, a clinic nurse is preparing to examine a Hispanic child who was brought by the mother for his first physical checkup. While assessing the child, the nurse would avoid doing which of the following? A, weighing the client. B, asking the mother questions about the child. C, having an interpreter if necessary. Or D, admiring the child. Love the connections you're using. Thank you so much. I try, make it fun. All right, so remember, let's go back up. While assessing the child, okay, remember, this is cultural, so the culture, we're examining a Hispanic child. All right, so while examining or assessing this Hispanic child, the nurse would avoid doing which of the following? So which of the following will we not do to around this Hispanic child? Okay, a lot of people saying D, admiring the child. Let's look and see. I almost went to lab values. What am I doing? All right, the answer is, what is D? I love when we all get it right. Either we're all right or we're all wrong, but at least we're doing it together. Okay? It says, what is D? Admiring a Hispanic American child during the first encounter with a stranger should be avoided, since this may give the child this may give the child the evil eye, or the child will get sick. Okay? If this is done, it can be avoided by touching the child afterwards. So admire and then touch. Yep. Sure. Let's look and see who got. Well, I think 99% of y'all got this correct. Let's look and see what the answer is, or who got it first. What is it? A lot of people said lipid. Great job. First person to say what is D is Petite 1990. Petite 1990. Great job. Petite 1990. Congratulations. You are on the scoreboard with 100 points. Woo, awesome. Who else got what is D? B. Monroe, Life with Mine, The Woman Writer, On My Grown Woman Vibe, Pretty Green Eyes, NC Pink Rose, Bad Gal Nene, Caramel Cutie, or said you already, Nurse JB, S. Griff, Thick Thighs and Peaceful, I know that's right, X Marie, Giselle Jones, Created Love, Daima, Official Crystal Betty, Unikia, G House, Green Eyes. Great job. Ooh, Nadira said, I remember this question in school. See, I'm telling y'all. Practice makes perfect. You never know when you're going to see these questions again in some kind of way or fashion, whether it's like they remix some words or the concept's going to be there, I promise. Okay, so that was cultural for 100. Let's go on to ABGs for 200. Go Nadira. All right, ABGs for 200. All right, so anyone that's just now coming in, hello, welcome. I'm Nurse Sam. Okay, I am your host of NCLEX Jeopardy every Thursday at 7 p.m. right here on, right here on Disney Channel. Sorry, right here on my Instagram Live. This is pretty much every man for himself. I'm going to read the question. You're going to see the question pop up. This is Jeopardy, so you have to answer what is before you say what you think the answer is. So if you say the answer is A, for this question, you would type in the comments and say, what is A? Okay? We're playing for the first person, well, we're playing for comprehension, obviously, but the first person to answers correctly and the first person to answer correctly with saying what is and everything like that is going to be the person that wins those points. Okay, so who's gonna win this 200 points for this ABGs question? All right, the nurse is told that the arterial blood gas, or ABG, results indicate a pH of 7.5 and a PCO2 of 32 millimeters of mercury. The nurse determines that these results are indicative of which acid-base disturbance. Is it A, metabolic acidosis, B, metabolic alkalosis, C, respiratory acidosis, or D, respiratory alkalosis? Okay. ABGs, for all my camp nursing school students, ABGs is definitely something that you want to, well, honestly, for everybody, but specifically, I'm talking to all you guys, but for all my campers, make sure you know that ABGs is definitely something that you need to be familiar with. Okay? First, let's go ahead and, did I answer? Nope, let's go up. All right. Answer to this question is, remember, whenever you're doing these practice questions, try to practice the time as well. Okay, so try not to spend more than a minute and a half at most on these questions. Okay, so correct answer for this one is, what is D, respiratory alkalosis. Respiratory alkalosis. Ouch. Okay, let's look and see who got it right. Or who got it right and who got it right first. Wait for it. B, Monroe. B, Monroe 68. Great job. All right, B, Monroe, you are on the scoreboard with 200 points. And you are tied with Life with Mai and Shanice. And then Petite, you are right behind them with 100 points. Okay, who else got what is D? Haley Compton, Life with Mai, Jazzy J, NC Pink Rose, Chris DeMonica, Pretty Green Eyes, Eliza, Blessed Favorite Beauty, Teen Bean, Official Crystal Betty, Mama K to you, I'm the ambitious one, Thick Thighs, Cam Shay. Great job. Awesome job to everyone that got that right. All right, if you didn't get it right, that's okay. That's why we're here. All right. So this is, once again, ABG's arterial blood gases. Okay. So first of all, they gave us, let's go back to the question actually. They gave us certain parameters. All right, they let us know that the pH is 7.5 and the PCO2, or the carbon dioxide, is 32. We're trying to figure out, based on these results, what would the disturbance be? The answer was metabolic. Wait, was it? No, sorry. The answer was respiratory alkalosis, and here's why. So, first of all, whenever you have ABG type questions, First thing you want to do is look at the parameters. Look at the pH. These are what they are going to give you, these things, probably with some more words associated with it. But the basic 3 things that you need to look at is the pH, and I look at pH first. Then I look at the CO2 or the bicarb, which is the HCO3. All right. pH is going to let you know whether it's alkalosis or acidosis. All right. Acidosis, acidic. Okay. Alkalosis is alkaline, or another word for basic. Okay. Whenever we have a pH that is greater than 7.5, question. Oh, damn, I put it right here. Normal pH is 7.35 to 7.45. So if it is higher, it's it's getting more alkaline or alkalotic. If it's lower than 7.35, it's acidic. So because our value was like 7.55 or something like that, I can't remember, 7.5, that's greater than 7.4, so that is an alkalotic pH. So now we know we have either respiratory alkalosis or metabolic alkalosis, but we know we have alkalosis. So all the other ones that say acidosis, all the other options that say acidosis, we could cross that out. We can cross it out because we already know it's alkalotic. Now, to figure out whether or not something's respiratory or metabolic, there's a couple ways, but this is my surefire way. Okay, whenever CO2 and HCO3. CO2, that carbon dioxide, that is a respiratory byproduct. All right, whenever it's a respiratory byproduct that is off, okay, you know it's a respiratory condition. Same thing with bicarbonate, HCO3. That is a metabolic byproduct. So usually if that's off, then you know it's a metabolic condition. Okay, respiratory, you want to think lungs. Metabolic, you want to think kidneys. Okay, they're both pretty much shaped the same. You got 2 of them. Okay. All right, so the PCO2 normal is 35 to 45, and then our results indicated that it was a 32. So we know that 32 is not between 35 and 45. So we know that the respiratory byproduct CO2 is off. So we know that's a respiratory condition. So now we have respiratory alkalosis. That makes sense? Okay, now that 32 normal, and I put a little graphic right here that's included in your farm packets, your first semester ultimate, it's in there. These are your ABG values. One thing that you need to pay attention to is the mnemonic ROME. All right, ROME is respiratory opposite, metabolic equal. Okay, and what that means that it's if a respiratory condition exists, an opposite relationship will be seen between the pH and the PCO2. So that's why it says respiratory opposite. All right, we already knew that the pH was alkalosis. So we know that the pH, the respiratory, we know that the respiratory is going to be the opposite. When we say the opposite, it means like right down here, you see that the higher values go within these normal values, the pH, HCO3, and CO2, the higher it goes, the more alkalotic, and the lower, the more acidic. However, with ROME, what that's saying is that it's going to switch the respiratory parameters. So it technically, instead of being 35 to 45, it's going to switch that around to be 45 to 35. So as that goes, so 32, that result of 32, if we have 35 to 45 and it's switched around, opposite, that 32 would, yes, it would be low, but according to ROME, it would be low. It'll be alkalosis. It'll be alkaline. Does that make sense? If it doesn't, I have an interpreting ABGs worksheet in your NCLEX study kits and your ultimate nursing school bundles. And then we'll get into that next week. All right. So did I pick the points? I did. No, I didn't. Yes, I did. I did. Great job. All right, so let's go ahead and get into next question. Wall card. Wall card for 300. All right, a prisoner with a known history of alcohol abuse has been in police custody for 48 hours. Initially, anxiety, sweating, and tremors were noted. Now, disorientation, hallucination, and hyperreactivity are observed. The medical diagnosis is delirium tremens, or DT. What is the priority nursing diagnosis? A, risk for situational low self-esteem related to police custody. B, risk for nutritional deficit related to chronic alcohol abuse. C, risk for injury related to seizures. Or D, risk for other directed violence related to hallucinations. Once again, what is the priority nursing diagnosis in this prisoner that was medically diagnosed with DTs or delirium tremens? What would be our nursing diagnosis? Just in case you haven't gotten to that part yet or y'all haven't started, there's a difference between a medical diagnosis and a nursing diagnosis. Nurses cannot medically diagnose. That's no. But we can we can make a nursing diagnosis. Okay? All right, let me see what y'all saying. I'm seeing I see C's. I'm seeing C's and B's. Lots of C's. Majority C's. Yeah, I'm seeing majority C's. But yeah, we'll get into that whole nursing diagnosis, medical diagnosis thing a little bit later. But that is the basis behind like care plans, nursing care plans. Okay, they take. We'll get into that later. But let's look and see what that answer is. Wall card? Yes. Wall card for 300. And the answer is, what is C? Risk for injury related to seizures. All right. So DTs or delirium tremens, those are a medical emergency and can be life-threatening. All right. Whenever, as a nurse, whenever you are honestly doing any action, intervention, creating any care plan, any of that, the goal is to not only make sure that that patient is getting better or improving. What we're really doing, our goal, and this is actually the theme of the NCLEX, is client safety. Okay, client safety. We're keeping that client safe. Okay, we're critically thinking 3 steps ahead to see what could possibly go right or wrong so we can avoid any injury to that client. Okay? Now let's look and see who got that. All right. Now with nursing diagnoses, I mean, I know at first they may seem kind of weird and just it's definitely going to take some getting used to. I'm not going to lie to you. It took me getting some used to. But once you get that in your mind, then you'll hear something and then like a nursing diagnosis will pop up into your mind. They're going to drill care plans into your brain. And so these types of questions will come a little bit easier. But it's definitely reviewed in fundamentals. Somebody said, which kit discusses the lab values? I know it's definitely, obviously it's in the Ultimate Nursing School bundle, but that's going to be in the pharmacology study kit, I believe. I believe that's pharmacology. Yeah. Let me go back and see who got what is C first. Wait for it. B. Monroe again. Hey, B. Monroe, you was just on the scoreboard with 200 points. You got an additional 300. So now, you now have 500 points, B. Monroe. Snaps to you. Great job. Who else got what is C? Mama K to you. Pretty green eyes. Eliza. Petite 1990, I Am the Ambitious One, Official Crystal Betty, Siptastic, Sashay, Kundalini, Kiss My Dimples, Cam Shay, great job, Amazing Paris, Teen Bean, Shanty, Amina, G House, Yoli. Awesome job. Great job, everybody. Next question. What did we just do? That was that ABGs? No, that was walk card. All right, let's go back to fundamentals. Let's go back to fundamentals. Okay. This one's for 400 points. Clay-colored stools indicate what? Is it A, an upper GI bleed, B, impending constipation, C, an effect of medication, or D, bile obstruction? Remember, this is NCLEX Jeopardy. You have to say what is before you say your answer. Okay? You don't have to type out the whole thing. You can just say A, B, C, or D, but make sure you put what is prior to whatever letter you're going to choose. Okay? Clay-colored stools. Clay Aiken colored stools. Let's look and see what that answer is. I'm gonna give y'all some time. Think about that. Upper GI bleed, impending constipation, an effective medication, or bile obstruction. These are common reasons why our stools will be discolored, but you have to, they're asking you to choose which reasons, the reason for this specific clay-colored stool, okay? It's not like it's black or green or red. Let's look and see. The answer is what is D? Bile obstruction. Bile obstruction. That's what is D. Who's the first one to get that? Ash the One. Hey boo hey. All right, Ash the One. You're the first person to answer what is, you said 4, but I know you meant D. Ash the One. I think with a 1 next to it. Yep. All right, Ash, you have 400 points. Great job. You're on the scoreboard. All right, so it says bile colors the stool brown. Okay, that's what it does. Any inflammation or obstruction that impairs bile flow will affect the stool pigment. Okay, so if bile is going to be the thing that makes the stool brown, and you cut off that supply, it's then going to yield a light clay-colored stool because that pigment has not yet been deposited into poop pellets. So, and don't laugh at my little clay-colored stool right here, okay? It's not really, it's as close as I can get to clay-colored with the options that I had, all right? So, regular poop, brown poop, to clay-colored poop, it's giving bile obstruction, okay? It's giving a cut-off supply of bile. So, yeah. Clay-colored. I answered that, yeah. First, who else got what is D? NC Pink Rose, Life with Mai, Jazzy J, Amina, I Am the Ambitious One, Ronnie M, Real Loves, Kundalini, Diamond, Amanda, Short Stuff, Shanice, Blessed, Favorite Beauty, Mama K to you, I Am Abina. Awesome job. Don't it feel good when y'all get it? Don't it feel good? Like, oh, I'm just getting these answers right and just got nothing on me. That's why we always celebrate the small wins. All right, next question. I'm trying to figure out what this one is. Oh. Next question. Speaking of ABGs, but let's get into lab values for 500. All right, so a client has the following laboratory values. A pH of 7.55. HCO3 or bicarb of 22, and a PCO2 or carbon dioxide of 30. Which action should the nurse take? A, prepare the client for dialysis. B, administer insulin as prescribed. C, suction the client to improve respiratory status. Or D, encourage the client to slow down his breathing. All right, this is an example of a critical thinking question, okay? Because there's multiple steps that you have to think through. You have to think ahead these few steps in order to get to this answer, all right? First thing you got to do is you got to evaluate, you got to interpret these values, all right? Remember I said whenever you have pH, bicarb, and carbon dioxide, always look at the pH first to decide if it's alkalosis or acidosis, and then see if the bicarb and or the carbon dioxide is off, and whichever one is off, that's how you know what kind of condition it is. HCO3, aka bicarb, is a metabolic condition, and if it's a metabolic condition, you know the kidneys are affected. Sorry. If it's PCO2, carbon dioxide, you know it's a respiratory condition in which the lungs are affected. Okay? So let that kind of lead you into your answer. Decide on what it is. Interpret that. Is it respiratory or metabolic? And is it acidosis or alkalosis? And based off of that that state, decide what action you can do to intervene on some of the symptoms that the client may be having as they experience either respiratory, metabolic, alkalosis, or acidosis. Does that make sense? Okay, so let's go ahead and get into what this could possibly be. I see a bunch of y'all change y'all answers. Okay, let's see what the answer is. Hold on, let me write down. It's 7.55, 22, and then 30. 3 pH. Okay. And the answer is, what is D? Encourage the client to slow down his breathing. Encourage the client to slow down his breathing. All right, so remember I said step one, we got to figure out what state, what acid-base state they're in. The client is in respiratory alkalosis. Based on those results, remember it said a pH of 7.55, which when we think about pH, normal pH is what? Actually, I'm gonna just go through with y'all. Normal pH is what? 7.35 to 7.45. So a pH of 7.55 is obviously high, on the high end, and you know that the higher you go on the scale for pH, the more basic you get. Okay, alkalotic. So we know it is blank alkalosis. That's what we know what it is. Now, the bicarb was 22 and the CO2 was 30. Okay, that CO2, that is low because normal is what? 35 to 45. Okay, 35 to 45. Now, if we know that 30 is below 35, but remember Rome, respiratory opposite, metabolic equal. Okay, usually the lower you get, the more acidic you get, but with Rome, respiratory opposite, the opposite, all right, of acidic is alkalotic. So low PCO2 is still alkalotic. All right, so we have, so our respiratory CO2, that is the thing that's off. That is lower than the normal range. So we know that our condition is respiratory alkalosis. Okay, now that's our first step. If someone is in respiratory alkalosis or is about to be in respiratory alkalosis, they are, you see it right here, it's caused by, what does that say? breathing too much, okay? Hyperventilating, all right? Hyperventilating. When you think of respiratory alkalosis, think of hyperventilation, okay? What happens when you hyperventilate? You're breathing out too much CO2, okay? Yeah. So interventions for respiratory alkalosis. What are your interventions for hyperventilating? If you took out the words respiratory alkalosis so it doesn't sound so scary and replace it with hyperventilation, what would you do? How would you intervene in someone that was hyperventilating? Okay? Brown paper bag. Okay? Or some kind of rebreathing, but it's usually that brown paper bag. That's what you see pretty much anywhere. So if you're out somewhere without medical supplies, and someone's hyperventilating, having a panic attack, whatever, they're breathing too fast, breathing too much, slow down that breathing so that they can like uptake that CO2 and that oxygen actually. So as they're breathing out too much, that brown paper bag is going to pretty much like be a rebreather almost. It's going to allow them to take back in what they're putting out too much of. Okay? Deep breathing exercise, brown paper bag. All right? Great. Awesome. So you see how that was like kind of like a two-step one? Oh wait, I didn't give those points. So who got what is D? What is D? D's nuts. Just kidding. I'm gonna scroll all the way up. Mama K to you. Great job. All right, Mama K, you are on the scoreboard. K to you. You are on the scoreboard with 500 points and tied with B Monroe 68 for first place. Y'all are going neck and neck. Okay, I think we have a few more questions, at least one more question, so we can see who can like break the tiebreaker. Who else got what is D? Great job to everyone. Who else got it? Royalty, maybe 1103, Sayoli, Eliza, Ash the One, Wallflower, Joanna, Gloricel, Smiles, Tracy. I am the bishop that said, damn, I went back and forth with myself with this one. Oh, I know. Go with your gut. Yes, 7.35 to 7.45. Make sure you know, in your brain, make sure you know the normal ranges for pH, bicarb, and CO2. So in the last little slide we had, hold on, this little nugget right here, that's from the pharmacology bundle. In the pharmacology page. Okay, that's going to be like your common NCLEX stuff. Make sure you know, like memorize this. Keep this little picture in your brain, all right? Note that values as they increase, it's usually alkalotic, and as they go down, it's acidic. But then keep in mind ROME, respiratory opposite, metabolic equal. Know that in your brain, okay? Because you're going to get a bunch of questions. You may get a bunch of questions where it's no words. It's just giving you values like pH this, CO2 this, CO3 this. And then you have to figure out what it is. Just know those values, okay? All right, let's go. Next question. Did I give points? I did. That was ABGs. Was it? No, it was lab values for 500. Let's do, what's this? Let's do wild card for 400. Ashwin said, also process of elimination. There wasn't info to indicate dialysis or suctioning like creatinine levels or respiratory rate or oxygen saturation. Very true. And then you have compensated or uncompensated. Hold on, let me see, where's my thing? Do this question. Do this question. Where is it? Wait for it. Nope. 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 Wait, this might be it. This whole cheat sheet for interpreting ABGs, you also have, I'm going to post something about this, actually. So never mind. Let's just read the question. Come and post something about that so y'all have it. A client arrived at the emergency department after suffering multiple physical injuries, including a fractured pelvis from a vehicular accident. Upon assessment, the client is incoherent, pale, and diaphoretic, with vital signs as follows. Temperature is 97 degrees Fahrenheit. Blood pressure, 60/40. Heart rate, 143 beats per minute. And a respiratory rate of 30 breaths per minute. The client is mostly suffering from which of the following shocks? A, cardiogenic. B, distributive. C, hypovolemic. Or D, obstructive. Okay? I definitely want to include this type of question because these are the type of questions that you're going to start seeing more of. And I don't mean that in content, I mean that in question style. Okay, you're gonna get, especially for next generation and even before then, make sure you know how to when you get a question like this, they're called this is basically like a case study. Okay, when you get a question and it's giving you the results and you have to interpret those results, it's basically a case study. Okay, the last question we did was also like a case study. Interpret these results and then tell me what action you would do. Tell me the intervention that would be most appropriate based off these results. Same thing here. All right. So we have a bit of a backstory. This looks like it's giving Grey's Anatomy episode 4. Like it's just person versus vehicle. You know, they're in they're trauma. Okay. They're in the ER. They're pretty banged up. All right. Look at the assessment. The client is incoherent, pale, and diaphoretic. Okay, so we're pale. We know we don't have a lot of blood flow coming to the face. Okay, diaphoretic. We're sweating. Incoherent. We confused as fuck. Can't really understand. All right, vitals 97.4 Fahrenheit. BP is 60/40. That low, high, normal. Heart rate, 143, low, high, normal. Same thing with breaths. Respiratory rate of 30 breaths per minute. Low, high, normal. Okay, so based off those results, we have a temperature that's fine, a blood pressure that's low, heart rate that's increased, and a respiratory rate that's also increased. So it sounds like there's lots of compensation going on. So let's figure out what our answer is. Okay. We're trying to figure out the person is clearly in shock, but what kind of shock specifically based off these results? Okay, and the answer is C, hypovolemic. Hypovolemic. Hypo means less than, volume. All right, they are going into shock based off of the volume of the circulatory system being too depleted to allow for adequate circulation to the tissues of the body. Okay, hypovolemic shock. All right, now remember they said that the client had a fractured pelvis. Fractured pelvises, well, they gonna lose about 1 liter of blood easy. Okay, so the body contains I think 5 liters of blood or something like that. I don't remember. One of them is already going to be, so 20% is already going to be out of here. So you're going to start to show symptoms of hypovolemic shock, okay? Now, I'm going to take it one step further real quick. Hypovolemic shock, what would be a nursing diagnosis for hypovolemic shock? 200 points to the first person to say it. 200 points to the person that will tell me the nursing diagnosis that would be equivalent to hypovolemic shock or hemorrhaging or, yeah, all those words. What would be the nursing diagnosis? And while y'all answering that, I'm going to scroll up and see who got, hey, what is C first? Who got what is C first? Mama K to you. All right, Mama K to you. You got an additional 400 points. So now, 500 plus 400, you're at 900, love. Great job. Who else got what is C, hypovolemic? C. Wayne, Eliza, maybe 1103, B. Monroe, Pretty Green Eyes, I Am Abina, Tracy, Dawn Lulu, NC Pink Rose, Official Crystal Betty, Caramel Cutie, Shanty, Jazzy J, Amanda, Born to be a Nurse, I know that's right, Short Stuff Daily, Justine, Teen Bean, Angel Dust, Miss Ebony Eyes, Lauren, Joanna, great job. Sony, you said C. With shock, you'll see decreased PP and increased heart rates. Conan G, you said C. Yoli, Royalty. I Am Fiona, great job. Short Stuff Daily said CBC, blood transfusion, IV fluid, supplemental oxygen. We, as nurses, can't order those things, but the question, that would be a good response if the question was like, what should the nurse, or what could the nurse expect for the doctor to order, or for the physician provider to order? What orders would the nurse expect to see in the chart? But we would not make the executive decision of saying, all right, I need a CBC stat and a this and that. We don't make those orders. But that is kudos to you for knowing those things though. All right, so let me see who answered my question as far as the hypovolemic shock. What's another name for it? Miss Ebony Eyes, fluid volume deficit. Fluid volume deficit. That would definitely be the nursing diagnosis that would be equivalent to hypovolemic shock. When they're bleeding when they have deficient volume, whether that's that volume or that fluid volume, whether that's blood, whether that's what would another thing be? What else kind of fluid can you be deficient in? I don't know. I can't really think right now. But yeah, definitely blood. Definitely blood. So whether or not you're hemorrhaging or any type of significant blood loss, that's going to be the nursing diagnosis. Because even saying something like blood loss, even saying something like significant blood loss, I see your comment, Kunda, that is a medical diagnosis. All right. Oh, C. Wayne, decreased cardiac output. That's a good one. That's a good one. But yes, it's fluid volume deficit. Miss Ebony Eyes is the first person to get that. Miss Ebony Eyes. So you got 200 points, Miss Ebony. But Smile 60, inadequate perfusion. That would be a good secondary one. And somebody else said something I love. Decreased output. C. Wayne, that was actually really good. I'm gonna give you 100 points for that one because that was good. Oh yeah, fluid volume deficit. A risk for dehydration. Thank you, NC Pink Rose. So if you're dehydrated, that's fluid volume deficit. Okay. Oh, great job. We're not prescribers. Great job. Fluid volume deficit. That was great. All right, so what was I saying? Yes, a fractured pelvis will lose about 1 liter of blood, hence symptoms such as hypotension, tachycardia, and tachypnea. Those will occur, okay? What I do want you guys to note is that there are early symptoms and late symptoms of fluid volume deficit, okay? So when they are first losing all that fluid, whether it's blood, in this case, let's say it's the blood from the fractured pelvis. When they are in the initial stages, those symptoms are going to be a little different from the stages, from the later stages, because by that time, in the later stages, your body's starting to lose that fight. Initially, your body compensates. So if you are losing blood, all right, your volume is getting lower and lower, what your body's going to naturally do to make sure that, you know, you don't die, but what your body's going to naturally do is take the remaining volume of blood and pump it out even faster so it can cover more ground with less people. All right, so when your body bleeds out, that's like, you know, telling all your red blood cells in your blood to come to work short. They're coming to work short. It's like, hey, look, 1 liter called out earlier today, long story, but we need you remaining 4 liters to do the job of all 5 of you. So I'm gonna need y'all to pull your weight and then some. So then they send them out faster, okay, to make up for the loss. That's what the compensation comes from, okay? But after attempting to compensate for so long, your body can only keep that up for so long as well. All right, so that's why you start to get tired. So what would initially be like an increased heart rate in the later stages, it will actually start to drop. Okay, it starts shutting down. Great one, NC Pink Rose. The kidneys start shutting down, so the kidneys start making less pee. It's closing down for the holidays. I'm just kidding. But when it starts to close down, it doesn't make as much fluid. The kidneys don't make as much urine. With that person losing lots of blood, they're not making enough to replenish what they're losing. So then your body just gets tired and like, just let the heart rate fall, man. I'm tired. Eventually, that starts to dwindle down and then result in like a flat line or zero pulse, aka patient death. Okay. Miss Ebony I said, intervention wise, we can elevate legs and place the patient supine to decrease the work of the heart. You better go. Okay. I love the critical thinking that I didn't even ask y'all to do. But that's honestly how you have to think about it whenever you have these questions, whether it's NCLEX or just your chapter 3 exam. It doesn't matter. You have to have that same mode of thinking, that same critical thinking mind from honestly day 1 of nursing school all the way to the end of life, especially while you're actually working and practicing as a nurse. Okay, so that's why it's so important to learn the fundamentals. It's so important to learn the basic things and really comprehend it, not just memorize it, because you're going to have to apply these to literally almost everything else. Okay, you wouldn't be able to know like the question we did about ABGs, you wouldn't be able to get that question if you did not know what the normal values were, because they're giving you values, and if you don't know how to interpret that, you don't know which way to go, up, down, left, or right. Is it normal? Is it too high, too low? That's your interventions are going to be indicative, and it's going to be based on whatever answer that is, which is why it's so important that you not only know and understand, but you comprehend, like really comprehend the basics and the fundamentals, because that's literally going to take you the rest of your nursing school career. Okay. Don't let it make you nervous. That's why we're doing NCLEX. That's why we have NCLEX Jeopardy every week, and have had it pretty much every week for the past 2 years, because practice literally makes progress. There's no better way to review for these things than honestly practicing. Because who's going to read the book every day over and over and over? No. Read it once, and then you review the rest of the times. Okay, read it one good time, and then you're going to either take great notes or just review it in whatever way that's going to work for you. My number one suggestion for review is just take practice tests. Take practice tests, which is why, so for week 3 of Camp Nursing School, I'm giving away, in addition to this, okay, one person's going to win this. In addition to that, I'm also giving 3 Saunders NCLEX examination books. This one's PN, but I also have RN over there. Yeah, I also have RN, but I just have PN right here. The difference between PN and RN is like 2 pages, I swear to God. And I've bought, this is what version? The 8th version. I bought the 7th and 8th version of both PN and RN, and they are very, 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 very similar. Okay, but whatever. I'm gifting 3 of these. Whether it's, if you're a PN, you're gonna get this one. If you're an RN, if you're going to be an RN, you're gonna get the RN one. But I'm gifting 3 of these Saunders NCLEX reviews to you guys. Not only is it amazing as far as notes and letting you guys know what to study, what's important to study, it does a great job of, testing you and giving you like a breakdown of the test taking strategies. What I also love is the online resources. Okay. Yeah. So like when you do get it, like at the beginning, at the front page, you're gonna get that little page where it's gonna tell you that how to access your student resources, and there's like 4,500 NCLEX practice questions on the online center. So once I get you this book, and you get it in the mail, it'll be a physical book. Get your online code and go and register for the online resource center. You get it included with the Saunders Examination Study Guide book. I'm already giving that to you, so you'll have the code. When you get to the online portion, you'll see, like I said, like over 4,500 practice questions. And the way you can get those questions are broken down, honestly, according to your need. If you want if you want to get like a practice question, or practice exam, just a whole exam, just for you to take, that's timed, comprehensive, just so you can see how you're doing. You can take like 60 questions. You can take like 60 questions of maternity if you want to. You can do it category or course by course. You can do it based off of the type of question. If I suck at select all that apply and I want to do a test that's all select all that apply, I can do that within Saunders. I am not sponsored. I am not sponsored by Saunders. However, I am just putting y'all on game. Okay? I used it when I was in nursing school in 2014. Like I said, I still use it for my content. I still use it for honestly a lot of my stuff, and for a lot of my refreshing my memory on a lot of things. It's honestly amazing. Okay, it's not as expensive as like UWorld. I think it's like, depending on the version, it's like less than $100. But this is a great investment. Okay, and I love it so much. That's why I'm gifting 3 of these to 3 of you campers. And if you want to qualify, remember you have to register for camp. It's free to register. Let's go ahead and just put your name and your email. We're already doing that. But yes, I just want to show that to you guys and let you know that those are going to be the other prize for the giveaway, in addition to that IV pole. IV pole, I'm thinking about P-Valley stripper pole. But yeah, that IV arm. All right, so sorry, I went on a rant. I definitely went on a rant. But yes, that was our last question. One second. But yeah, that was our last question. So if you want to play the rest of these questions, download the app. I'm going to bring that up right now. Nope, not that one. All right, if you want to play the rest of the questions, remember we have 25, like each game is 25 questions. So every week you get 25 new questions for the NCLEX to practice. But it's only in the NCLEX Jeopardy mobile game. We did the live version. If you want to play all 25 questions, you have to play the mobile version. And it's exclusively, you cannot get it anywhere else. Not online, you can only get it through the Nurse Sam app. It's free to download, free to play. 25 questions every week. You can't beat that, okay? Download the app. You can search it in your Apple store. You can search it in your Android Google Play thing. Or you can go to the link in my bio or in my stories to download it. But that's how you play the full 25 questions, okay? The person that won, as far as how many points, first place winner is going to be Mama K to you. Congratulations, Mama. Literally. All right, so you won an Ultimate Nursing School bundle. Okay, congratulations to you. Make sure you DM me and give me your full name and your email address so I can go ahead and send that to you. Remember, it is digital, but it is printable if you would like to print it out as well. If you do want to print it out, that is optional and it's totally up to you. You have to do that independently. However, I do give you a site and a coupon code for what I've seen to be the cheapest printing site. Do not take this to Office Depot or Office Max. They will charge you an arm and two legs. Okay, so go to printme1.com and use the code I give you after you purchase the bundle or after I send it to you and you get that code. So Mama K to you, congratulations, 900 points. Congratulations to all you guys that participated. An extra shout out to everyone that got on the actual scoreboard. Congratulations. But like I said, even if you did not answer quick enough, or even if you did not get on the scoreboard and you were still answering those questions correctly, getting that name called, or if I didn't see it, at least you know you were answering correctly, you're on the right track. Okay, even coming here and doing this with me for an hour, that's an hour of practice you just put in that 2 hours ago you didn't have. So I hope you guys learned so much with me tonight, because I know I did. I learned quite a bit. Y'all teach me something like every time, I swear. But yes, let me know. Oh, thank you so much. The app is amazing. Thank you, Ronnie. Thank you. Yeah, just download the app. My NCLEX Jeopardy is good for NCLEX RN, NCLEX PN, VN. It doesn't matter. It's still, the difference between NCLEX RN and PN is so small. It's not even okay. But what there is like a noticeable difference is, and that's just in, like, the answer is going to be different. Delegation, because there's going to be like delegation and leadership questions coming from, for you to answer as the practical nurse, or for you to answer as a registered nurse. And one, like for the PN, it'd be to either get your superior. For the RN, it would be to get the doctor or to do that initial act or something like that. But long story short, yes, all my material can be used by both RN and LPN. That is why I waste my time and my money buying both versions of every textbook ever, for honestly further proof to y'all that although the scope of practice is different, we are learning the same thing. We are learning the same book. It is the same book. I'm so sorry. We just learn ours 4 times as fast. We do it in a year, y'all do it in 4 or 2, whatever. But yes, LPN and RN courses. Okay. Oh, the site for cheap printing is printme1.com. Printme1.com. All right, that's the site for this cheap printing. Whenever you purchase a bundle from thenursesam.com, you will get an email with that information, the print information, and you get a code for printing if you would like to. Everyone gets a code, but not everybody likes theirs to be printed, but you will still get it printed out. Do they print books? They print, when you say books, I don't know what you mean, but they print, this is what I got from, this is a perfect example. This is exactly what I got from printme1.com. They print and bind up to 400 pages in color. They bind it. It is professionally done. Okay. And it's also delivered to your doorstep. Okay. I got this but from me ordering it to it arriving on my door was like 5 days, maybe 6. One of those. They make it binded like that. But that's if you get the that's the 400 page one. That one's the bundle. But yeah, if you get the bundle and you want to print out the bundle, you can do it like that. Or some people, they like, if they don't get the bundle and they just get like different study kits, like smaller study kits, like this one, they print that out too. They print it and bind it as well. The less pages, the cheaper. But 400 pages will cost you about like 80 something with the discount that we sent you. When I went to print the same 400 pages at Office Depot, $210. $210. Okay, so if you guys would like the Ultimate Nursing School Bundle or the first semester bundle, definitely check out thenursesam.com, the link in my bio, the link on my profile, the link in my stories, or when you download the app to get the to play the NCLEX Jeopardy mobile. As you can see right below it, you can check out the Ultimate Nursing School Bundle, and you'll be able to purchase it from the app as well if you would like to. Okay, so once again, I don't know if y'all are joined. If y'all have joined or registered for Camp Nursing School. Let me go back to it. But just in case. All right, we are in week 3 of Camp Nursing School. We're doing fundamentals and health assessment. Sunday at 6 p.m. right here on live, it's going to be our camp assembly. So we're going to go through, we're going to recap week 3. And during the fundamentals week, you're going to get some fundamental study tips, need to know concepts and key topics that you definitely need to know for in order to be successful in fundamentals. And we're also going to be doing some camp activities as well. You should have definitely, I sent that one Tuesday, you should have at least taken your fundamentals pre-quiz so you can see kind of how you're doing. Those 5 questions, I'm about to send y'all more questions down, and I'm about to send y'all a video of a fundamentals review that we did earlier this year. It's just a great review right before you start this class or right before you start the semester. There'll be a great review video for you to just review, let play, listen to it if you would like to. But it's a great overview of the things that you would definitely need to know and make note of in fundamentals in order for you to be successful. Okay? All right. I'm going to let y'all go. Thank y'all so much for joining me. Join me next week, Thursday, for NCLEX Jeopardy, and it will be majority pharmacology and dosage calculations. That's week 4. Okay. Once again, if you have not signed up for Camp Nursing School, go ahead and sign up at literallycampnursingschool.com. Take up the literally, but campnursingschool.com. Link in my bio. I will see y'all later. Let me know if you have any questions. Okay. All right. Thank y'all for joining me, and I'll see y'all next time.